and I'm going to then introduce Juana. Right. Thank you so much, everyone, for joining. We have this afternoon an amazing woman and an amazing doctor that is part of our team. We are so happy to have her in our team. Her name is Juana Montero, and I'm going to read her story here a little bit. She's a gynecologist with more than 30 years of experience dedicated to women's health. She currently practices in a gynecology specialist in a hospital in Florida, in Miami, and in parallel serves as a professor of medicine at the University of Florida. Over the past 13 years, she has complemented her medical career with her commitment to Nu Skin as an expert in epigenetics, focusing on helping women feel more confident, healthier, and empowered through science, innovation, and comprehensive care. So I have the great pleasure to give the microphone to Juana, and then after this, she's going to open the microphone to questions. Particularly, the doctors will be able to ask, anything.
Okay, can you hear me?
From a medical, I guess, point of view. So I, give the microphone to Juana, please.
Okay, can you hear me?
Yes, we can hear you. And everybody else, if you can mute yourself, please. And then just open your microphone when you want to ask questions. Thank you.
Okay, so thank you, Paula, for inviting me. You know that I already love to be with some of you and talk about what I love, I do. Okay, so as Paula said, my name is Juana Montero. I'm OBGYN, originally from Spain, but I have been working here in Miami now for 11 years. And yes, I'm OBGYN because I wanted to empower women through science. So this is my passion. This is what I do every day. And this is why I'm here. Okay. So we are going to talk about Nu Skin today. I knew this company just back 11 years ago because my husband, who is a dermatologist, someone wanted to do like a demo with a small machine in the face and everything related to cosmetics.
Please, Selva, mute your phone. Thank you.
So everything that is related to cosmetic, he likes to have my opinion. So they did a demo with a very small machine in the half of my face, and I'm very used to very good and safe products because, as I told you, my husband is a dermatologist, but the results were like very impactful. It was very different. The part of the face that was treated related to the other part. But as a doctor, I know that not everything that has good results is safe. So then I went to see what's going on. So then I found a company that is has been working now for years. Is an American company. Is in Provo, Utah. And what I really captured my attention immediately, I wanted that to capture my attention because I love the results. So based on that, what I saw behind that was science. So first, I found that they have 75 scientific working just for Nu Skin, different specialties, what is very surprising because I don't know any company who has so many scientific working just for a company. The second thing is that even they have these persons, they cooperate with universities very prestigious universities and very prestigious doctors that they are not committed to new skin. For example, the study of the collagen is conducted by Dr. Diana Draelos, that is the #1 cosmetic dermatologist in the United States, and she has nothing to do with new skin. So if she signs a clinical trial, it's because all that happened is true. He has nothing to say about that, okay? So first, that's that kind of serious things. Second, the thing that most of the products are validated for clinical trials in which the efficacy and safety is something that they take in account. So no supplements in the market are validated by clinical trials. And I'm going to give you an example. Some years ago, the main pharmacies in the United States, they have an audit, and they found audit in the supplements. And they found that, for example, if they say that one supplement has 11 milligrams of vitamin A, what they found in this audit is that not only they have the amount that they said, but there was no vitamin A in the supplement. So people buy supplements thinking that what they are taking in the best scenario is efficient, but sometimes not only is not efficient, but also is not safe. Okay, so this company has clinical trials that validate the supplements. Okay, so and the third thing, it was the biggest one. It was the age loss science. So age loss is a patent in which they found first they bought a laboratory that they were mapping the human genes. Okay, then what did they? It was identify what genes are related to all the things with aging. So skin, energy, sleep, metabolism, all the things. And then what they found is some ingredients could modify the way that this gene is expressing. So with this, they took these ingredients, always natural ingredients, and they made the supplements with the right ingredients that have the capacity of modify the way that the gene express, doing the gene expressing like they did when the person was younger, with clinical trials that validate the results that we see, but also the safety, and with scientists that they are always working at the top of the innovation. So everything together, there is nothing else in the market that have competency that can compete with this, and that's why I love this company.
Thank you so much, Juana, for your experience that you have told us, how you met the company, and also what you think that is important, that is unique within New Skin that caught your attention. I would like to let the doctors ask questions here. We have Salini is in the UK. She's originally from Sri Lanka. She just started the business. She has lived in Canada and also in the UK. She's a GP. We also have here Pooja. Pooja is an aesthetician from Leicester. And we have Sole from Argentina, right, Sole? Yes. And Sole is also a gynecologist like you.
Wow.
So, yes. So please, if you have any questions, please open your microphones and go ahead, ask.
I would like to introduce myself because I'm in the middle of a paddle match. So I stopped my match with my husband just for this meeting. I'm very glad to be here. I'm really very glad to see a lot of people from around the world and other doctors. It's exciting. let me introduce, I will be very short. For those didn't know me, I'm Soledad Minteguiaga. I'm a doctor. I'm also a gynecologist. I've been working for Pharmanex for an year now. I'm currently based in Argentina, although I live in Canada before. And I would like to tell my story. Like, I was first introduced to the company by a colleague, another gynecologist, who told me about one of their products. It was the Beauty Focus Collagen Plus, right? So I didn't know the company before, and I became truly interested in the science behind the brand and the results it delivered. Like any healthcare professional at the very beginning, I did like a research about the company, about the products, and like Paula, I found out like there is nothing similar in the market, like though through that process of research, I was able to identify those products that truly add value to or complementing my practice, my professional practice. And I'm truly grateful to have discovered. I'm in the car, right? So I'm very here. At any moment, anyone can appear, sorry, or do some noise, don't worry. I have discovered this company and the strong scientific foundation behind the products and the philosophy of being the force for good that deeply inspire me. That combination of science, I will say purpose, and the results that motivated me to join. But to speak it more specifically about the business, let's talk about it. I found it that it's a very intelligent business, right? Because we already have our clients, of our patients in our consultation room, right? So the same way that we prescribe or we recommend any other medication or any other product, we can do the same with the Nuskin or Pharmanex products, like supplements, right? And this is the area of the company that I like the most, because I'm also trying to help women to be healthy, right? To feel better all the time. And this is the area of the company that I am interested in. And on the other hand, something that is very important to say for those who are doctors or are interested to join the company, that what is intelligent about this business model is that two things. You can't work with anyone you want. Like, you can't join or add people to your team, people that is truly motivated about helping others to feel better and to feel better and, I don't know, feel beautiful or whatever. And you can also work without working. Like, if you are on vacation or if you are, I don't know, like on a convention, congress, you are also going to have an extra income, right? Or you can plan a retirement income for your future. And that's amazing. And now we have the opportunity for the first time to open India. And that's why you guys are here, because we are trying to help people with Indian heritage living abroad to join the company, and people who can open for the very first time the India market, right? I don't know if you speak about that before.
We haven't touched upon the India opportunity yet, but it's true that a lot of the people here are looking at expanding in India, because some of them are from Indian heritage. Not all of them, like you, and there's also another lady from Sri Lanka that has more connections actually with Canada. But obviously, I think that also she has a lineage. I guess that you have Indian friends as well. Yes. So we have another lady here called Dipti. Dipti, are you also a doctor?
Hi, I'm a doctor. I'm a gynecologist. I'm currently working in Mumbai. I'm practicing since last 8 years. And I'm
Amazing.
a cosmetic gynecologist also.
Excellent, amazing. You're very welcome to this meeting. So we just had Juana, who is a gynecologist in Miami. She's Spanish origin, And then we also have Sole, who is in Argentina. She's also a gynecologist, talking
nice to meet
about their experiences. Brilliant. So does anybody have a particular question or anything else that they want to share with Juana? Please, share.
Yeah, so I just want to ask one thing. So it was very insightful listening to the two doctors talking about their experience with the business and with New Skin. And it's nice to know because in a world where you have a lot of companies, a lot of people trying to say that well, my product is good and that is why you should buy this product. But yeah, few people saying that it is scientifically evidence based. So I heard about, and I've heard about this earlier as well, that it's based on epigenetics and there are clinical trials. I mean, as a doctor, only thing I want to ask is there anywhere the links to the clinical trials, etc. Because before saying to, as a medical professional, before saying to anybody anything, I want it to be evidence based. I want it to be backed by evidence. So, is there anywhere, links to these clinical trials where I can go read the papers, go through the scientific evidence myself, so I am better equipped to answer their questions? Because obviously, when people know about this, they will have questions like, if I say that, as a doctor, if I say that, okay, this product is more scientific compared to the other product, and that is why you should go with this. So obviously they will have questions. And as a medical professional, I would like to be right in my own aspect as well. So are there any links? Is there any, or anywhere on the website? Are these clinical trials published anywhere where I can go and read them myself, find out more about it myself, and then kind of better equip myself to talk to people and answer their questions? That was the only thing that I want to ask at this point.
Yes, of course, I understand you because I am the same. So yes, in the website, Paula can tell you there is a section that is the library, and you have there all the clinical trials that the company has published, at least some of them. And also in every product, at the end, you have a source, and they have some explanation how they develop the product, and if they are supported by clinical trials, the clinical trial that they did.
I would like to add something. If you don't find the clinical trial, there is an email. You can email the company and they will provide this information for you. Because some of the clinical trials, they were removed from the webpage because of the other pharmacologist companies will try to do the same. So for some reason, because they don't want them to copy them, some of the studies are not there.
Yeah, that's a good. Thank you.
Yes, and Florencia
okay.
is actually posting the email. So if you want to write this down, it's called Product Specialist at newskin.com. So it's in the
I
chat
got that,
in the actual meeting. And they're very nice.
Yeah,
and
no, this is quite helpful.
Product Specialist
This
at
is very helpful.
newskin.com.
Well, thank you. Yeah, thank you very much.
And Pooja, you can also call. We have our in the UK. Our call center is based in Denmark, and you can actually call. You press number 1, and then you can ask to be passed on to Product Specialist as well. And then you can have a conversation, and then they will email you the stuff as well. So they're really nice like that.
Okay, yeah, that would be nice. Yeah, that's helpful to know. Thank you very much. Thank you for that information.
Yes, no problem. And also because sometimes you want to know something specific as well, because we have such a big range of products. So I guess that is something you want to know about something specific in one product or the other product or whatever it is, not like the whole spectrum of studies. It will be very a lot. So then you can actually call them, and then they're very good at answering all this.
Sure. Okay. Thank you, Paula. That's helpful.
Good,
Thank you so much.
Juana, I wanted to ask you if you can share us, how are you contacting other doctors or nurses or people from the healthcare to your team? Can you tell us something about that?
Yes. So it's like everybody that everybody works with her network. So my network is most people related to health, and what I do is I tell about the company in the way that I have told you before. So people in the health, we are more strict with the things that we recommend. Um, this is based on what I told you. The company with the scientific, the people they collaborate with, the clinical trials, and the patent based in the epigenetic. This is something that most people are very curious, very interesting, and very surprised.
So doctors basically do the business the same way that we do the business. Everybody does it the same.
The business, you do it in the same way. The thing with the doctor is that we look for different things of the people that they want to have results, and we go deeply, is
Thank you.
I would like to add something for those who are related with health. We have a great opportunity right now because the company is going to launch the Prism IO, right? So for that, for those who are related with health, professional care, professional healthcare or whatever, we are going to have a different tool now to offer our patients or our clients to measure the level of antioxidants, carotenoids they have in their skin. And with this, we are going to be able to tell them, hey, you need to supplement yourself. You need more antioxidants to prevent the develop or some diseases, right? So I think we have an advantage right now. Like now is the era of the healthcare professionals. So that's why, I don't know, Paula, do you think the same? Juana, sorry. Do you think the same? We are now in the right moment.
Totally. And if you see how the company has evolutioned, at the beginning it was more cosmetic, then introduced pharma, and now even the cosmetic part is super important. And I love all the products that I use, but they have expanded a lot the amount of supplements that we have now. So because of people in general are more worried and more conscious about what is exactly the health, and not just that they want to live more. We are going to live more, but everybody wants to live more but better. And this is something that is a tendency. Everybody wants that, and then the product related to pharmacies has been expanded a lot. They are develop a lot of products every day. So yes, I think that now the people related to health is where they are putting the focus. Yes, I agree.
The other day I read that people are not looking for anti-aging; they're looking for longevity, and that I think that was a very good sentence, because it's exactly what we offer. Sometimes people think that we are offering beauty that is superficial. People say, "Oh no, don't worry, I don't do anything to myself in the face." But our laboratory is not about that. It's completely the opposite. It's all about health and nutrition. So
Yes,
it's very important. And I think that doctors in this sense are in an advantage, because the doctors, they're just because they're doctors, they're always coming from this kind of like a health angle, right? And they have a very good presence, and people trust them, right? Because they are in the health professionals. So their advantage is that when they recommend something, like if you recommend Pharmanex, if you recommend the Prism, people will listen to you.
yes,
They will listen to you.
Yes,
And thus, and I'm sorry, and thus,
on that
your
note,
business grows quicker, even. So it's a great advantage.
Yes, and also one of the how do you say lemma company? One of the
one of the sentences, or one of the important sentences from New Skin.
or belief for the company is that you are going to look good outside because you are well inside. It's from inside to outside. So, and this is, everything is based on health.
Yeah.
I have one more question on that note, actually. I'm sorry, I might be sounding a little bit skeptical, but just want to know. So, I mean, as we know that the company is expanding to different countries and selling products, which also include supplements. So, are all the products like FDA approved, or what's the governing body, or who regulates the products, especially the supplements, for example?
Yes, so this is a good question. The company is responsible to have all the approval before being able to sell the company in each country, which means if they are going to start operating in India, they have been getting all the permissions and all the approval necessary to those products be sold in India with all the guarantees that your country is requiring, is requesting.
And that's also the reason why the company doesn't have all the products in all the countries, because they try to select, to choose which products are better for that population and that country. And they need to obtain all the approvals and certifications or whatever, regulations. Every country has different regulations. So that's why the portfolio for India is different than the portfolio for Argentina. So here in Argentina, we only have a few supplements. And those are the ones that I use with my patients, right? But you have to be relaxed.
I understand.
And everything is approved and everything has all the norms and all the stuff that they need to have.
Sure. Okay. Okay. So the supplements or the products available in, for example, US, they will all be FDA approved. Is that right?
Yes, FDA. You say FDA approved. So the FDA usually doesn't take care of the supplements. Okay, we have in the United States all the supplements, and they are all they meet all the requirements to be sold in the United States. But the FDA specifically just take care of some things like the technology and those things. They usually don't take care of the supplements. Okay, this is another kind of regulatory.
Yeah, can I add something about that? That's true. That's why some of Permanex products, they are not included as drugs, and we cannot say that this product treats diseases because they don't have the regulation. That's why they are supplements, right? They don't need the regulation by the FDA.
Yes.
Right? So that's why we said they prevent, they give you wellness, right? They improve your overall wellness, but we cannot say that this supplement is going to heal you, right?
There is no treatment.
Yeah, sorry, I wanted to add just, if you read the info pages, the product information page for some products or supplements, it says that we follow the FDA regulations and everything, but we don't sell food or drugs. So it's like the same regulation, but we don't need that approval because we don't sell not food or drugs.
Yeah, because for the supplement, as Ole said, there is no like examination of every product. There is a regulation related to the supplements in general, okay? But it doesn't mean that it is FDA approved because that it hasn't passed all the steps to be FDA approved because it's not necessary for supplements. Understand?
And one of the things that I wanted to add is that, of course, these supplements can be recommended by anybody. And I would imagine that the FDA products have to be recommended by doctors. by people that have the study and the licenses to recommend these products. All right,
Yes.
it's a different type of product that we're talking about.
FDA is treatment, so they need a prescription, and supplements you can buy in the supermarket.
Yes. Sorry to cut you short, but the meeting is going to finish. So it has been really wonderful being with you, Juana. Thank you so much for everyone that joined. The meeting is going to end very soon, but we wish you a very happy Sunday, and thank you so much for your time, Juana, and everyone else.
Thank you.
Take care. Bye-bye.
Bye.
Bye-bye. Thank you.